before the last, I would say the last trial that was done in France called the PRODIGE 7, we were using HIPEC with cytoreductive surgery for colorectal cancer relatively routinely for peritoneal disease because most of our retrospective studies have shown some survival benefit, both overall survival as well as progression-free survival. The reason it's now being debated in regards to the HIPEC portion of the cytoreductive surgery in HIPEC is because the PRODIGE 7 trial done in France showed that they compared patients who underwent cytoreductive surgery alone to those who underwent cytoreductive surgery with HIPEC, and they found no difference in the overall survival between the two groups. However, there was a significant survival benefit in both groups. The survival that they found was over 40 months, which is pretty remarkable for patients with metastatic colon cancer. So in my eyes, it was actually a positive trial for cytoreductive surgery, at least, showing that there is benefit to the cytoreductive surgery portion. But the HIPEC portion, we still don't know because the drug that they used in the trial is not what we typically use here in the United States for our GI malignancies. So they used a high dose oxaliplatin, whereas here in the US, we primarily use a Mitomycin C based regimen for the HIPEC. So it's kind of like comparing apples and oranges a little bit because we're not using the same drug. They also did a much shorter time period for their perfusion. They use 30 minutes, whereas we use a 90-minute perfusion here in the US. So it's hard to say for certain if their findings are what we would have with our patients. So that's why most of us who do cytoreductive surgery and HIPEC still do offer HIPEC for patients with colorectal cancer if they have minimal disease, so minimal peritoneal disease where it's not going to add significantly to the morbidity of the operation, and where we feel like we really did get a complete cytoreduction completed. So I think it's still debated, the benefit of the HIPEC, but we do need a true randomized control trial looking at Mitomycin C here in the US to definitively say there's no benefit for the HIPEC.